Well, hello there. My name is Dr. Brian McKay of Neuropathy CoreHealth. And you're probably wondering, well, what is neuropathy? Well, in this brief video, I'm going to explain to you what neuropathy is, how it may make you feel, and how you can know for sure if you actually have it. Okay, in this illustration here, you have, well, you see a nerve cell body. That red looks like an egg in the middle of the yolk, or vice versa. There's little tails, we call dendrites. And the myelin sheath is those little nubs along the line that go down to what we call the axon terminal. This is the anatomy of a nerve cell. And it'd be pretty important that you understand how this works, because some of the areas where it's going to be affected will be at the axon terminal. The dendrites can also be an affected area. And the myelin sheath is where a lot of problems come in with neuropathy. And I'll explain more about that. Maybe you know what it's like to feel like it's walking on glass. Maybe you don't. Maybe it feels like your feet are on fire. Maybe you don't. What happens is the sensation to those nerves we just showed you, those nerves are not properly communicating with the brain. It could be from alcohol, if there's too much alcohol in your system. It could be from diabetes with too much sugar in your system. It could be from chemotherapy, which eats away that covering, that myelin sheath that we just showed you. But it's very important. One of those feelings is like walking on glass. It's not normal, and we need to help you. Some people report the feeling as if bugs are crawling on them. Night pain. Legs get heated up in the middle of the night. Sometimes you have to get up and shake it out in order to start to feel better. Again, not normal. This is one of the signs and symptoms of neuropathy. Now, neuropathy will affect the lower extremities more so because it's further away from the heart. Again, it's important that you know if you have neuropathy. Just so you've had these feelings may not be conclusive. Now, there are a number of different tests that you can do to see if you have it, neuropathy. But a good examination can make a big difference. And it depends if the doctor's listening to you. Well, in Neuropathy CoreHealth, we plan on listening to you, making sure that you're getting the proper diagnosis. What we like to do is we like to use what's called a thermal imaging scan. It's a lot less painful than having a needle EMG, and a whole lot more comfortable, and also will tell you whether or not you have neuropathy. It's one of the things we do here at Neuropathy CoreHealth is try to make you feel better, not make it hurt. Thank you. So neuropathy is a problem where we have the nerves, and as you can see here, that white part is that cell body, and those axons and dendrites that we showed you earlier. What happens is these need to communicate with each other up until the nerves that go all the way to your spinal cord, to your brain. And when you have an interruption of this normal communication process, you will develop painful swelling of the feet, that bug crawling feeling like you're walking on glass. But more than else too is you probably feel like you've lost your balance. And that's pretty serious because a lot of falls end up hurting people and end up in nursing home as well. So it's important to understand the nerves are super important. They have to work properly to communicate with the brain. That requires a good amount of oxygen to the area, adequate blood flow, proper glucose regulation, and stimulation. Well, let's tell you how we can find out if you have neuropathy. All right, a thermal imaging scan. Everybody's familiar with this. They're using it now with COVID to see if someone's has a higher temperature when they walk into a room or a hospital. It's pretty standard stuff. What we do is we make sure you have adequate blood flow going to the extremities, primarily again the legs. And what we do is, you think you have neuropathy, you don't know. Well, first of all, doing nothing about it is not a good idea. What we've done is we've lowered the cost for the thermal imaging scan. Thermal imaging scan will cost you $47. It's usually $197. I invite you to give us a call, click this up in the right-hand corner, come in and try to see if you have neuropathy. It's very important because ignoring it is not going to make it get any better. Our goal in Neuropathy CoreHealth, people who have neuropathy, could be diabetic, they could be neuropathy. We don't prescribe medication, we use natural methods, patients, too numerous to go over right here. The idea here is first step is to find out whether or not you have neuropathy. And the easiest, my suggestion is you come in for the $47 thermal imaging scan. So go ahead, if click book now, call us up, get in here, get the test, know whether or not you have, or maybe you just want to medicate. Can be helped. Either way, knowing is half the quality. I'm Dr. Brian McKay, Neuropathy CoreHealth. I look forward to seeing you. I look forward to helping you. Our goal in Neuropathy CoreHealth is to help people who want to get help with